ROMA Ministers Forum, Nigel Belchamber.
Earlier today, my buddy Fred Dean said to me, go out there and break a leg. Almost did. It's one of those things that happen. Good afternoon, everyone, and welcome to the 2017 Ministers Forum. One of the disadvantages of inkjet paper is it runs, but nevertheless, we're fine. First thing I'd ask you to do is turn off your cell phone if you haven't already done so. Thank you very much. And my first duty is to introduce the members of the Ministers panel. On my far right, Laura Albanese, who's the Minister of Citizenship and Immigration. Next to her, Bob Shirelli, Minister of Infrastructure. Next, Deepika Demirla, Minister of Seniors Affairs. Then Stephen Del Duca, Minister of Transportation. Brad Dogood, Minister of Economic Development and Growth. And Kevin Flynn, Minister of Labor, on his left. Michael Gravel, Minister of Northern Development and Mines. And then Dr. Eric Hoskins, Minister of Health and Long-Term Care. Beside him, Mitzi Hunter, Minister of Education. And then Jeff Leal, Minister of Agriculture, Food and Rural Affairs, and Minister responsible for small business. Next to him, as you know, Premier Kathleen Wynne. On my immediate left, Bill Morrow, Minister of Municipal Affairs. On his left, Marie-France Lalonde, Minister of Community Safety and Correctional Services, and Minister responsible for Francophone Affairs. I think that qualifies for the longest business card at the table here. On her left, Catherine McGarry, Minister of Natural Resources and Forestry. Beside her, Eleanor McMahon, Minister of Tourism and Culture and Sport. Then to her left, Glenn Murray, Minister of the Environment and Climate Change. Yasser Naqvi, who's the Attorney General. And on his left, Liz Sandals, President of the Treasury Board. Charles Souza is on her left. He's the Minister of Finance, as you know. And his left, Glenn Thibeault, Minister of Energy. And finally, last but not least, on the immediate left, David Zimmer, Minister of Indigenous Relations and Reconciliation. Okay, that's your Ministers panel. You were probably sitting partway through the Premier's speech going, I can't quite read the card, but that must be Minister so-and-so, isn't it? So now you know whether you were right or wrong. This is an opportunity for you to pose questions of general municipal interest to members of the Provincial Cabinet. I say general municipal interest because over the last couple of days, today, yesterday, and some of you tomorrow, you'll have had the opportunity to participate in over 250 delegations with ministers and parliamentary assistants in order to deal with local issues. Now, I know that you're not going to come up and pose a question that doesn't have a local impact, but just for the benefit of your colleagues in the room and to assist the ministers to be able to give a comprehensive answer, please put it into context, the broader municipal context. I appreciate that. If you persist and dwell on a local issue, very specific issue, don't be surprised if I interrupt. Or eventually, actually, I have the power to cut off the mic. Brian at the back knows that this means cut if you attempt to hijack. Part of that is because you only have about 45 seconds. We are pressed for time. We can't extend the closing time of this the same way the starting has been delayed. At least not quite to the same extent. So I think you can probably get your question down in about 45 seconds. And I've asked the ministers here as well to be equally brief if they possibly can in terms of dealing with their responses. You must begin by stating your name, the municipality that you represent, and a member of the cabinet here to whom you wish to address your question. That does a couple of things. Number one, it allows for them to get prepared, but more importantly, it allows for the cameraman at the back of the room and the person back there running the microphone to turn their mic live and to get the camera focused. So it's very important. And only one question to one minister. It's not a multi-part question. There are no rebuttals. There are no supplementaries or debates. If you do have a second question, sometimes it works to beetle to the back of the shortest line. It's going to be tense today in terms of the numbers I see out here. We may get 20 questions in this period of time, and we may not. And as always, I reserve the right to add new rules should the circumstances warrant. So my first question, I'm going to go to microphone number 1. Microphone number 1, please. Your
Thank
name?
you, Nigel. My name is Jennifer Murphy. I am the mayor of Bonashir Valley and the warden of the county of Renfrew. My question is to the Minister of Community Safety and Correctional Services. There's no surprise that we are facing an aging population who will need our vulnerable occupancies and homes for the aged more than ever before. With the upcoming legislation for the retrofit of some of these homes with automatic sprinkler systems by January 1st, 2019, and further legislation for more homes by January 1st, 2025, and the costly retrofits per room or residence, which could cause the closure of some of these facilities, especially in rural Ontario, would the ministry, in conjunction with the Ontario Fire Marshal's Office, consider investigating alternative, innovative, and less expensive technology to provide fire suppression for these important homes? And one of the examples would be the Haven Fire Suppression System.
Thank you, Minister.
Well, thank you very much for your question. So I'll say yes, definitely always an interest to engage and have conversation. Before my political life, I used to work in our retirement home industry. Actually, for over 14 years, I've owned and operate my own retirement home in Orleans. So I know how sensitive that issue is for sometimes very small operator and the cost associated with this. Having said that, I also know that we need to protect our seniors and make sure they are safe. So I would love to engage conversation with you and anyone who's interested. Thank you.
Okay, thank you. Microphone number 2, please.
Thanks very much. Heck McMillan, Mayor of Trent Hills for 13 years, twice past War, Northumberland County, and member of the UWC.
It's good to see you here, Hector.
Thanks very much. And now currently survivor of the 2 most deadly cancers known to mankind, with the last one diagnosed at stage 4. My question to Minister Dr. Hoskins: where do we leave off since AMO in Windsor? Well, we all now know the IRE nano knife works, and I am living proof. And that there are no Ontario experts, but they're coming. And I've been working with the UHN, and they're looking for a little more funding, and they're prepared to help make that happen. I've helped now over 36 Canadians, mostly Ontarians, get to Stralsund, Germany for the same procedure I had. And I only ask of you today to accept this gift, a research document produced by a past Ontario Liberal MPP, retired pharmacist, and recipient of the Order of Canada. This document could be the holy grail to solve not only Ontario, but all of Canada's healthcare financial woes. He claims the Federal Patent Medicine Prices Review Board has not been doing their job, and at the 50th percentile, Canada is paying upwards of $65 million per day, more than European countries for the exact same drugs. Think of the infrastructure dollars this would free up. Dr. Hoskins, can I put this gift in your hand and ask for your staff to investigate it?
Yes, and thank you, Mayor. And let me begin by saying with all sincerity how nice it is to see you here today. And,
Thank you, Hector.
and
Appreciate
Mayor, as you mentioned, we had the opportunity to speak last August, I think it was, at AMO. We had the opportunity to meet as well at Queen's Park in the fall. I am gratified and very happy to know of the success of your surgery in Germany as well.
Thank you, Minister.
I was just
Go
allow
ahead.
me just. So I think, fortunately, we've been working in parallel ways. So I know that you had the opportunity to meet with the CEO of University Health Network, I think last week. I've been, and my ministry has been working closely with University Health Network as well, understanding their leadership with the nanoknife that they brought to Ontario and are using it for experimental purposes with liver cancer. We believe that we have the opportunity, and we are now in the process of working out the final details of the ministry being able to support University Health Network to continue that experimental work, but to expand it to include pancreatic cancer, and quite simply to enable more Ontarians who are eligible to receive that treatment. Understanding it remains experimental at this point. So I look forward to being able to continue working together with you on that. I think it's an important piece of research, and I commend you for your advocacy.
Thank you, Minister. Microphone number 3, please.
Thank you, Mr. Belchamber. I'm David Henderson, the Mayor of the City of Brockville and an AMO board member, and this question is to Minister Flynn, Minister of Labour. Okay. So, Minister Flynn, I understand that you want to continue the discussions on capacity to pay, the municipal government's #1 priority with the Fire Protection Act. And forgive me, but there's a fair amount of cynicism in this audience that the only changes coming forward in that act are the 3 areas of streamlining. And if the discussions haven't worked to date, why doing the same thing would make you think that they're going to work more? For ministry session after ministry session here, or minister session, this issue has come up again and again, and we continue the dance with the Firefighters Association. So consensus is a worthy objective, but it doesn't seem to be working here. And how long are we going to keep doing it? And the question I have to you is, perhaps the ministry and AMO could put together a prepared proposal or an amendment that might bring the Firefighters Association back to the table with a higher commitment. Would you consider that approach?
Minister Flynn.
Thank you. And as I said, thank you, Mayor Henderson. Thank you very much for that question. And certainly you are right. It's an issue that I anticipate being asked every time that I sit before an audience like this. And let me thank you, before I answer, let me thank you for the way that AMO has conducted itself, the way that members of AMO have conducted themselves as we've tried to stick handle what is an issue that I think has plagued us for some time. What we were able to do in bringing the parties together during the past couple of years, I think, is now eliminate what we talked about during the past, and that is, well, there was streamlining involved, but there was also the nub of the issue, the heart of the issue. So, but everybody was saying that we should change something. Everybody was saying there was little things that could be changed away, should be changed along the way. The problem is that nobody was changing them, and they were always in the way. As of December of last year, what we did is we did 3 things that people had asked us to do that both parties agreed should be done. We've moved them off the side now. They're off the table. They're done. They're part of the legislation. What I've asked is the new president of AMO and the new president of the Firefighters Association now to join me in a very scoped discussion about the issue that you yourself has raised. We've had the first initial meeting of that. We've got more meetings are scheduled, but it really is a scope discussion now, whereas in the past it was a very broad issue. By eliminating the other points through legislation, we've got a very clear path forward now, I think.
Okay. Thank you. Microphone number 4, way at the back.
Don Murray, municipality here in Kinloss. My question is the Minister of Health. As you're aware, we've met with you before over our rural hospital in Kincardine. We partnered with the municipality of Kincardine to do studies that have been asked for. We now have one of the biggest refurbishment jobs going ahead at Bruce Power, and I'm wondering if there will be more funding coming to finish our redevelopment of our local hospital. Thank you.
Thank you. And the refurbishment and the sustainability and the growth of the Kincardine Hospital is very important to me, and I've had a number of conversations with the local MPP as well in that regard. So we're working very closely with the LHIN and with the hospital itself. There have been recent developments, positive developments, I would describe them as. and we're committed to continuing to work forward with them. There's no question in my mind in terms of the merits of the proposal, and I've invited the hospital and the LHIN together with the ministry to work closely together. And I think as well, as all of you would agree is important, that I've made my best effort as well to make sure that the local MPP, that she be fully aware of the process, and I've engaged her to the greatest degree possible so that we can harness all of these resources and move forward as expeditiously as possible. But it certainly is one of, with regards to infrastructure, it's one of my high priorities to see this through.
Okay. That was perilously close to a local question. It involved 2 municipalities, but a substantial portion of Ontario's generating capacity, so I allowed it. Microphone number 1.
Thank you, Nigel. Jamie McGarvey, the Mayor of the Town of Parry Sound. In the absence of the Ministry of Housing and Community and Social Services, I'm going to direct the question to Premier Wynne, as it's a question that a number of municipalities certainly are interested in. Municipal governments across the province are anxiously awaiting information about the basic income pilot as a potential alternative approach to supporting the most vulnerable. In some cases, municipal governments have requested to be pilot sites. Is there an update on this proposal, and how will local municipal input be involved as the pilot continues to develop?
Well, thank you. Thank you for the question. And I'm very excited about this pilot. I think that it's something that has been talked about for decades. And Hugh Segal, who has been a senator and who is a real thinker, has lent us his support and his expertise in designing the pilot. There are consultations going on right now. They're not done yet. I think one of the challenges we have is that there are many municipalities who would like to be the location of the pilot. We're not going to be able to put aspects of the pilot everywhere, so those choices are just being made now. You will know in the spring when we bring forward the budget. We will have the design of the program in place. I think it's very important that we get some data. You will know that one of the last pilots, the last research that was done was in the 70s in Manitoba. And what we're looking at is, can we see better health outcomes? Can we see better school completion rates, better job retention? Those are the kinds of really optimistic outcomes that I think we can look for. So you'll get the design. You'll see the design of the project in the budget. So it's not too long to wait from now. Thanks.
Thank you. Microphone number 2, please.
Yes, Frances Smith, Mayor of Central Frontenac and a member of the Rural Mayors Forum of Eastern Ontario. And my question is for Minister Lalonde. Many municipalities that receive OPP policing services have written to your ministry's predecessor over the last year about how the OPP billing model is charging for wind turbines, communication towers, billboards, and other structures that do not need policing. It's just not fair, reasonable, or logical. We have heard nothing back from the government on this frustrating matter. What are you, as the new minister, going to do about this issue?
Mr. Lalonde.
Well, thank you very much, Your Worship, for this questions. I had the pleasure this morning of meeting with a few delegation on that subject. And as you mentioned, it's been raised on a few occasions as a concern regarding those inclusion. It is being reviewed right now. I know that the OPP has had discussion with Impact. And I would say, as part of the decision process, as we are reviewing that, I think it's important to make sure that if a decision was to be made, it is the right decision for all. As we brought this new model, it was to make sure that we have some fairness and equity within all our municipalities. So definitely the conversation is there. I've been on the job for 2 weeks, so stay put, stay tuned, but definitely it is something that is being discussed.
Thank you, Minister. Microphone number 3, please.
Thank you very much, Nigel. Kevin Eccles, Mayor of the Municipality of West Grey and a County Councillor with Grey County. My question is to Dr. Hoskins. Sorry, you have to cover your eyes. You didn't want to look at me, Dr. Hoskins. The question is, we have the EPIC program. We were very pleased and privileged in Grey County with our paramedics to put the EPIC, which is basically, from you, Premier, going back in time, having paramedics go into the home, basically a doctor doing house calls. As of February 28th, the funding for this program, and a very successful one across a couple of other municipalities that have piloted this for aging at home and all of those aspects, it's been tremendously successful. But as of February 28th, the funding from the province to continue with this program, supplied in a great partnership, we're going to have to cut it off if we don't receive any more funding coming forward. It has relieved a lot of pressure on our emergency wards, hospital, and hospitalization for a number of community members. Yes or no? Can we look forward to the funding coming forward?
Thank you. Have to tell you that this means we're trying to see your eyes. It's really difficult here to see faces with these lights, so it's not meant in any other way.
Yeah, it is. It's a little bright up here with these lights. Sorry, it wasn't in any way meant as a slight. I was also looking to see where the question was coming from, to be quite honest. So with regards to community paramedicine, so it is an incredibly important pilot. It's exceeded my expectations. I think we have about 30 community paramedicine programs around the province, $4 million annually. I believe so strongly in this. It has been a pilot up till now, and we I expect, I think in the coming days or few short weeks, and I apologize, it's this close to the end of the fiscal, it's funded up to the end of the fiscal, as you know, but I've asked the ministry to help us transform it from a pilot into a program so we can, all of us, have the confidence that this important contribution by our paramedics will continue.
Thank you, Minister. Microphone number 4, please.
Thank you very much. My name is Pam Sain. I'm with the Township of Minden Hills. And my question is for either the Minister of Municipal Affairs, is either for Premier Wynne or for the municipal,
We'll let Minister Morrow deal with it, I think.
Thank
so
you.
if it's municipal affairs.
Municipal affairs.
Yeah.
And the question I have in my discussions with and questions to the president of the IESO at a national energy conference, to our Municipal Climate Change and Action Committee, we all agree that the Planning Act should include renewable energies. And this is something that has not been included in the planning policy, which takes away our ability to plan our communities and to control our resources and to put things where we need to put them based on our information from our professionals in the area as well as from our community members. We have been basically taken out of the benefits by these projects being dropped into our communities with no control. So could somebody please put those back in the Planning Act? Thank you.
Minister Morrow?
Is it on? Well, thank you very much for the question. It's an interesting one. I will admit, quite frankly, that it's not a question that I've heard before from anybody. But I've been in the ministry now for about 6 or 7 months. I'm very interested in what you've brought forward, and I'm happy to take it back and give it some serious consideration. We have not talked about it previously. Within my ministry, it's something that I hear you clearly on as a former municipal councillor. I think I have some sense and accommodation for what it is that you're trying to accomplish. So I'm very happy to take this, bring it back to the ministry, and have some discussions about it.
And you have to know that ministerial staff have already started working on the response to the minister, and that happens with every minister. There are numerous staff in the room. So thank you for your question. Microphone number 1, please.
Yes, my name is Bill Vraybosch. I'm the Mayor of East Paris, Rural Caucus, and every other title they've given me so far about small and rural. I was really happy with the Premier suggesting that maybe some of the ministers are going to let the rest of the rural mayors know they're in the area once in a while, so I won't have to chase Michael Gravel down John Street when I see him walking.
Your question,
Bill. Minister Hoskins. The proportion of seniors in rural Ontario population is significantly higher than in urban. The limited transportation options and service access often leaves seniors isolated and vulnerable. Are you working, or how are you working with other ministries across the ministries to develop community and home health solutions to effectively serve vulnerable seniors in rural areas? We want to keep them there, and they can't stay there sometimes because transportation is a big thing for them. Thank you.
Mr. Hoskins?
Oh, thank you, and I really appreciate that question because we find, and this is already going on in Ontario. Imagine if, as a senior, for example, you're in your home and you require home care. We now have programs underway. Of course, we have about 750,000 individuals, 2/3 of them seniors, that are receiving home care on a regular basis, on an annual basis in this province. But we also have programs like telehome care, where we have healthcare professionals that are interacting through a variety of mechanisms and on a regular basis. It may be daily, it may be weekly, it may be on the phone, it may be by email, maybe by FaceTime or using an iPad. Where there's, and also we have forms of remote monitoring as well, where perhaps the individual does monitoring and can send that in using information technology. It's all proven, simple to use, consumer friendly, patient, client, caregiver friendly. So we've got some incredible models that are in use today around the province, which allow us not only to add convenience to Ontarians that require this level of support, but also it allows a level of monitoring and support much greater than other means, for example. And so what I believe that we need to do, and we have an opportunity to do more of, is to, well, and I mean, this is why I've used the refrain patients first since becoming health minister. It's not that it's a new term, but every decision that I make, I try to turn it around, not from the perspective of a program or service, but how it would change the experience of an Ontarian or their caregiver or their family. I think we have the opportunity now, partly because of new technologies, partly because of incredibly well experienced and trained healthcare professional staff, to be able to deliver more care through a variety of means directly to where people are, so they don't have to make that often challenging. My parents are 88, neither of them drive. They're in a rural environment. It's challenging to actually get to the health care. We've got the ability, and we're doing it already. We need to expand it to take the health care to the individual.
Thank you, Minister. Microphone number 2, please.
Peter Ketchum, Reeve of the Township of the Archipelago, and I'd like to address my question to Minister Lalonde, Ministry of Community Safety and Correctional Services policing costs. Congratulations on your recent appointment. By now, I expect you've been briefed on the ongoing work to modernize policing. Ontarians pay the highest policing costs in the country. It will take a strong political leadership to achieve new legislation that brings policing into this century. We were told that a bill would be introduced this spring. Are you still on track to do this? And how will we know that the changes will actually deliver improved efficiency and effectiveness of policing and help change the trajectory of costs?
Thank you. Minister Lalonde.
Yes, on track. So that's the quick answer. As it's been reiterated in my mandate letter, definitely this is something that we remain committed to modernizing as we bring our strategy for Safer Ontario. You know, before even I became the minister of this portfolio, we had numerous conversations with my local law enforcement, where now policing is changing, right? The role of our police officers, the role of how we deployed it, who do we deploy it, and at what time do we deploy certain aspect of it. So I want to say thank you to all our law officers, though, and congratulating them on their good work to keep us safe every day in Ontario. That's one thing. But at the same time, we realize there's aspect where we need to work closer together with our stakeholders, with our municipalities, with AMO. So this definitely on track to move forward. The Police Services Act is being reviewed. You should have some follow-up conversation in terms of engaging furthermore with our stakeholders.
Okay. Thank you. Microphone number 3, please.
My name is Ann Eady, Mayor of the Municipality of Kincardine in beautiful Bruce County, and I'm also a councillor with the County of Bruce. And so we are concerned about the provincial government's understanding of some of our rural Ontario needs. Not all of rural Ontario is losing population. Some areas like ours are growing. We need our schools and hospitals and other infrastructure to have proper funding to meet our existing and growing demands. I am really glad to hear Minister Hoskins' commitment to following our Kincardine Hospital. You're welcome in our municipality anytime, Minister Hoskins.
Is that what it takes?
So this is a question more for the Premier. Does the provincial government realize that a one-size-fits-all approach for rural Ontario, hospitals, schools, and other infrastructure needs to be modified to meet different local needs? There's the perception that, you know, there's declining population and everything.
Yes, the short answer is yes, we do recognize that one size doesn't fit all, whether it's in healthcare. Eric gave an answer in terms of getting healthcare to people in rural communities. I think there are transportation solutions as well as technological solutions. There are some communities where there are transit solutions. There are investments that have been made. So I think there absolutely. When I was talking about rural schools, I was talking about the communities where there is declining enrollment, and there are a number of those. But absolutely, I understand that there are pockets of growth, and that's a very good thing, and we want to support those. We want to support those communities and make sure that policies are flexible enough that they work for everyone.
Thank you. Premier, microphone number 4, please.
Thank you. My name is Mike Hentz. I'm a councillor, municipality of Dutton-Dunwich. And my question is for the Premier. It is an energy question, but I believe that people would like to hear from the Premier on this. I'll acknowledge that Minister Thibeault met with our municipality this morning. We appreciate that and has agreed to meet again. And it's concerning energy policy that is causing great hardship to our farmers, small business, and households in my community and many others. And one of the solutions, Premier, and I'm going to ask you to cancel those projects granted under LRP 1 in March 2016. The power is not required at this time, and many of these projects were awarded in unwilling host communities.
Minister, or Premier, is that a question you wish to address?
Well, I will just say that I think the majority, if I'm not, and I am looking at Glenn Thibeault, but I believe the majority of the projects in LRP 1 were in host communities. There was a new process that had been put in place that took much more into account the community predisposition to these projects. And as you know, we've suspended LRP 2 at this point. And we will be entering into the conversation about our long-term energy plan. And will we cancel those contracts? That is not something that we're proposing to do. I understand that there are some communities, as I say, a minority of those communities that were under LRP 1 where there wasn't 100% agreement, and that's my take on it. You know, we put a new process in place that gave, as I said, much more weight to the municipality's position on this, and we'll continue to take that into account going forward. I don't know, Glenn, if there's anything you want to add.
Yeah, since the minister is here, Minister Thibeault.
Yeah, thanks for that, Nigel. Thanks, Premier. I don't need to reiterate too much more, and it was a good meeting this morning. I know we'll continue to meet and talk about that. Just the one thing I do want to emphasize is, though, even when a contract is offered, though, the process is not over. So project developers still need to obtain all the required licenses and approvals. I know we talked about the REA in this morning's meeting as well, environmental assessments before they can start construction on their projects. So, you know, there are other things in place that still need to happen. We're going to continue to work with the IESO to work on this whole process to ensure that you know, we continue to have renewable energy. Just like you said this morning, no one is really against green energy. There's just concerns with the way the process unfolded, and I recognize, I hear that. I know my friend Ron Higgins is here somewhere as well. There you are. Sorry we couldn't meet as well, but you know, we're having similar conversations. So thank you for bringing that forward this morning. We'll continue to have those ongoing conversations.
Thank you, Minister. Microphone number 1, please.
Yes, Sally Martin. I'm the Deputy Mayor of Central Elgin and a County Councillor in the County of Elgin. And my question is for the Honourable Mitzi Hunter, Minister of Education. As a teacher for 32 years, and I taught in both rural and urban schools, I have come to understand and believe that 300 students is the ideal size for a rural school in hamlets and communities. They are community hubs. They are in an area where housing is affordable for young families. They produce great pride in their community. They provide an excellent education. I taught 2 Rhodes Scholars in a 300-student small school. Every student knows every teacher. Every teacher knows every student. So our duty is a pleasure.
And your question, please.
I'm coming. Small community schools are more than economics need to be involved here. They are social centers, they help with mental health with children, and they are communities centered. Rural schools, vibrant rural communities need a community elementary school. Will you relook at your current policies for 400 to 450 students and moving all students to urban centers so you don't destroy our rural communities?
Thank you.
So thank you for that question, and I know I've been meeting today with a number of your colleagues to talk about the decision-making that's happening with rural schools and with schools across the province. And one of the reasons why we put in place the review process that involves school boards working together with their local municipalities and their local community organizations is for that very reason, so that these decisions are made at the local level. And that includes the size of the school and where that school should be located in the community so that it serves the best needs of the community. So I want you to know that, you know, I recognize that these decisions are very difficult for communities when there has to be a change. For the accommodation reviews that are underway right now, I realize that they have generated discussion, and those are really tough discussions, but they're also an opportunity for that information to come forward to the school boards so that they can make the best decision possible with the local community in mind, and what is the best, what will best meet the needs of those local communities. So you have that support. I know the Premier spoke in her remarks earlier in terms of the value of schools to communities, and we recognize that. But when there is a decision that has to be made, we want to make sure that the school board has the right sets of information, that they're working together with the municipalities and the organizations surrounding that community. So that's the direction that we're moving forward in, and we will continue to support local schools in rural communities.
Thank you, Minister. Microphone number 2, please.
Thank you, Nigel Graydon-Smith, Mayor of the Town of Bracebridge and Vice Chair of Ontario Small Urban Municipalities. This question's for Dr. Hoskins. Doctor, a couple of years ago we talked about our local circumstance of the funding formula not working very well for our medium-sized hospital, and in conversations with my municipal colleagues throughout Ontario, it's become apparent that that funding formula doesn't work very well for a number of medium-sized hospitals in the province, and that a number of them are operating in deficit, and that a number of them are having to make very tough choices about the services they deliver, and implementing possibly hospital improvement plans, which seems to be a bit of a misnomer because it's reducing services in some of these centers instead of improving them. Minister, it's clear that the funding formula needs a rejig. It's clear that these hospitals need funding that will allow them to operate in the black every year and not go into deficit. And can you give us a time frame when that's going to happen? And can you promise us that our hospitals in medium-sized communities are going to be properly funded?
Minister.
Well, thank you, thank you for that question. It's the funding formula that we developed a number of years ago, which shifted to just providing envelopes of funding to hospitals based on the numbers of patients seen or the size of the community to quality and outcomes. So we were funding those facilities that were meeting certain standards and achieving the outcomes that all of us as Ontarians would like to see. It's been extremely difficult for our hospitals, not just medium-sized, across the province in the last 3 or 4 or 5 years, particularly after several years of no increase to their base funding, although there were increases to other elements, but the base funding, as you know, is a significant portion of all of the funding that a hospital receives. And in this year's budget, an increase of $345 million to our hospitals, roughly a 2% increase to their budgets, which was augmented this past fall by an additional $140 million hospitals across the province in that fall allocation got an additional at least 1% to their base funding. Notwithstanding that, we also, a big part of my work over the course of the year is working with individual hospitals, their board, their CEO, to look at those particularly that find themselves in challenging circumstances for a variety of reasons. I don't believe any formula is perfect. We try to get as close to correct as possible, but we do look, we're monitoring the situation with hospitals on a regular basis, and we do regularly step in, I would say probably with anywhere between a dozen and 2 dozen on an annual basis to provide them with additional funding in addition to the funding that I just described. And I'll continue to work hard to do that on a go-forward basis as well. So it's difficult when you shift to a new funding formula, and it's only been, I think, about 4 years now, which I believe, I haven't heard a single individual say that it was not an improvement in terms of how we fund for procedures and staffing in hospitals. So I believe it was a good decision. I believe that it's a work in progress for anything like that. And so with nearly $500 million new dollars for our hospitals this fiscal year alone, and continuing to work with them on a go-forward basis, I'm confident. In fact, even now, we're seeing many of the pressures that existed a year or 2 years ago, we're seeing some relief to that, and we're seeing the vast majority of our hospitals coming through at balance or better.
Microphone number 3, please. Thank you, Minister.
Well, thank you, and my name is Paul McQueen, and I'm Mayor of Grey Highlands and Executive Member of AMO, and home of the famous and well-liked Chapman's Ice Cream. Wow, everybody likes Chapman's. I guess my question is for Mitzi Hunter and Premier Wynne. And just a comment, Premier, I would say that it was nice meeting you on Saturday at the screening of the Maple Morning at the TIFF Center, and very, very nice day.
Your question, please.
So my question has sort of somewhat been answered, and I will say from the quote, Premier, that you mentioned today about working to keep schools open, I'm very pleased to hear that. And also the comments that's coming from Minister Hunter about to tell the school boards to work with local solutions. Is that going to be an immediate direction to those school boards? Because we do have a local solution.
So that is a direction to school boards that has been in place for some time. And in fact, it's something that they have heard from me long before I was the Premier, and it's something that both the previous Minister of Education and Mitzi Hunter is acting on. And so, I can't say clearly enough how critical it is that school boards work with each other. And when I say that, I mean the coterminous boards. So the French boards working together, the public boards, the Catholic boards, everybody working together, and understand that working together and then working with municipalities is the way we are going to have. So to the question about the 300 students, you know, if you have a situation where you've got 2 small schools and they are in different school boards, and by coming together you could have 300 to 400, 450 kids, that's how you keep a school in a community. And so I guess I would say to any of you who are facing situations where there aren't school boards working together, or you're frustrated about that, please let us know, because it is absolutely a tenet of our education policy that they work together, and that I know we can't say that you have to work, municipalities, you have to work with your school boards, but it sure is in the best interest of communities if you work closely with the school boards.
Thank you. Premier, microphone number 4, please.
Thank you. Bonjour, je m'appelle Jeanne Charlebois. Je suis la mairesse de la ville de Hawkesbury. We're in the far east of the province. I'm proud to be there. My question is to Premier Wynne. Premier Wynne, we are one of the poorest towns in the province. We have one of the highest rates of taxation in the province. We have at least 70% of the public housing of the counties. And you've helped with the mental health of our community and drug addictions by providing funding for the new building that went up. Thank you. You gave us $141 million to expand the hospital in our town, the regional hospital in our town. Thank you.
So
You gave us 30 mil. I'm coming. You gave us 30. Sometimes it's nice to say thank you.
Okay.
You gave us 30. You are investing $30 million in a lagoon that you own for the environment of our town. I have the fastest growing elderly population in our town, in the area. My question to you is, now I need more public housing. I have people who have worked all their lives, raised big families, and they need public housing just as our young couples do. So what can we do for that?
I think there are a lot of people that share that question. So
Absolutely.
We'll allow it.
The housing issue is a huge, huge issue, and we are putting increased funding into housing. I know that municipalities have some more flexibility, and they are seeing more housing dollars. I will say that this is an issue that I think has to be solved at 3 levels of government. You know, I would say that we need a national housing strategy so that the provincial government can partner with the federal government and then with municipalities to put in place the housing solutions that we need. And as recently as this morning, I had a conversation with, actually I was talking with the Mayor of Toronto, and when we weren't talking about transit, we were talking about housing. And you know, I said very clearly, we have always been very willing to step up to the plate, work with the federal government, and I suspect that the federal government is hearing this across the country. I know that they are, and we are certainly there ready to work with the federal government and with municipalities when we have that national housing strategy.
Thank you. We're about the scheduled quitting time, but since we started close to 15 minutes late, we'll go between close to 10 minutes over. So microphone number 1, please.
Thank you, and this is, my name is Alan Thompson, Mayor of Caledon, and it's to the Premier, and it's concerning fluoride. This is an issue across our water systems all across Ontario. The challenge that we have is our medical officers defend the science that it is important. It helps our vulnerable, it helps our poor, it helps our children, it helps our seniors. The challenge is there's so much extensive lobbying starting to take place to have fluoride taken out of the water system, as much as we know it has a huge impact for the vulnerable. Could you please make a mandate to take a position to say it be done versus getting it out of the local municipal arenas?
Is that Premiers or Minister of Health?
I'm going to ask Minister of Health to speak to that. Thanks.
Thank you.
Thanks, Alan.
So, along with being the Minister of Health, I'm also a public health physician, and so that obviously has allowed me to gain a pretty deep understanding of the benefits of fluoride, which is probably, you know, the WHO and most health experts see it as one of the most important breakthroughs in the last 100 years, probably next to vaccination and the discovery of penicillin. And and its safety. There are, I think, about 150 reputable organizations around the world. This is important, I think, for everybody to hear, that have determined that it is absolutely safe for consumption, let alone the benefits from a health perspective, a self-esteem perspective, avoiding dental caries and everything that can go along with that. An equity issue as well, because if you have the financial wherewithal, you can get fluoride treatment, for example, from your dentist. But by the way, the largest group of individuals that don't access fluoride through their dentists are seniors. So it's an important health equity. Important enough that myself and the Chief Medical Officer of Health wrote to, I think, every mayor, certainly we have, this goes without saying, expressed our support to the boards of health as well as to the public health officers, just how critically important this is. If I can ask you to do one thing, it's to follow the science and the evidence and resist those individuals based on no science and no evidence. This is the water equivalent of the anti-vaxxers. And it's incredibly important for those of you who are counselors, all of you who are leaders in your communities, to resist those attempts based on hearsay and in the face of vast scientific knowledge in support of, that you resist those efforts, because more often than not, it comes down to a vote of council. And so it's really in your hands to make sure that those children that otherwise will have a mouthful of cavities and bad teeth that prevent them from developing the full self-esteem that we would want them to, let alone the direct impact between dental health and heart health and diabetes and a whole host of other diseases, and the equity issue. We all have to stand up for this, folks.
Thank you, Minister. Microphone number 2, please.
Thank you. Alan Spacek, Mayor of Kapuskasing, President of the Federation of Northern Ontario Municipalities, and my question is for Minister Murray. Mr. Murray, as Minister responsible for environment and climate change, many rural and northern municipalities are wondering what the impact will be on their residents as you implement your strategy. So my question for you is, what can we expect as your investment strategy moves forward for our residents in terms of opportunities and benefits?
Okay. Minister Murray.
Thank you very much, and thank you, Your Worship. This is the action plan. On page 64 is the entire transportation sector, for example, where we have programs to retrofit just about every home and building in Ontario. So we're looking for communities that want to step up and do an integrated plan. So if Kapuskasing under the Municipal Challenges Fund, let's say, said, look, we want to be net zero on transportation, we want to be net zero on buildings. That, by the way, includes all kinds of things, of whether it's agricultural equipment, large trucks, vehicles, you're looking at switches to electric, to natural gas, to biofuels. We're looking at trying to work with communities. So for municipalities here, as we roll out the Municipal Challenge Funds, we're hoping that you'll come out with that. There are two major goals. One is to, right now, because as you may know in Ontario, about 35% of our emissions come from transportation and about 25% from buildings. So our priorities are to decarbonize those, take the CO2 and methane out of those systems, and to cut costs. So I just came back from some negotiations in California. I visited a group of smaller communities, and I was there that are all net zero communities that have some of the lowest heating, cooling, and energy and transportation costs in North America. So that is really locally grassroots driven, which people ask for. And so I would love if you want to invite me to come out to Kapuskasing and you and I can sit down and figure out a way to cut your greenhouse gas emissions and in transportation and buildings, cut your energy costs. Contrary to what's been said, natural gas and these other lower carbon fuels are a very important part of that, and I think you should follow up with Minister Leal and Minister Morrow and Minister Thibeault, who are working very closely with me on that as well.
Thank you, Minister. Microphone number 3, please.
Thank you. My name is Liz Huff. I'm a councillor in Leeds in the Thousand Islands, and I sit on AMO's Rural Caucus and the ROMA board. My question is also for the Minister of Environment and Climate Change. Minister Murray, we had a session this morning called Rural Ontario's Hidden Opportunity, Small Village Water and Wastewater Innovation. We had a standing room only crowd. It was a report that was funded by your colleague, Minister Leal, through the RED program. It was applicable to many, many small hamlets that don't have municipal water systems across the province, although it was centered in a community that you visited this summer. Thank you very much. We feel there were many recommendations teased out in that study, but a significant one relates to the regulations in your own ministry, which are, we feel, outdated and not suitably forward-looking or sufficiently taking advantage of new technologies to allow us to have a different approach to water and wastewater in Ontario's smallest hamlets. And we'd like you to commit to bring your brain and the brains of your team to work with us on looking for new approaches.
Minister.
The answer to your question is yes. And first of all, I just want to give you a big shout out, because what you're doing and with redistributive, local, innovation-driven solutions to water is very much what we're doing. We have about, I think, about $155 million going into innovation with Minister Moridi and Minister Duguid on looking for demonstration projects with people who have water or sewer utilities who want to demonstrate these technologies, or in communities that don't, whether we're doing a lot with First Nations, and I know the work that you're doing, we'd very much like to do that kind of thing. One of the greatest opportunities with the low-carbon economy is the economic opportunities that come to rural Ontario and Northern Ontario. I mean, Oxford County, I met with, is just providing incredible work. I was with Warwick this morning and Lambton County. Extraordinary work going on there. The idea of, as you may know, that we beat K-cups. You know that plastic, how many of you have K-cups and plastics? Well, it was rural Ontario, just outside of Chatham, Kent, where Pure, working with Guelph, invented the compostable coffee pod, which is now sold and is made out of the waste of the coffee plant. That was a rural Ontario, Guelph, Chatham breakthrough. So I would be very interested, if you want to take a little look at that incredible job creator, about looking at how we push more jobs back to small and medium communities. And water is one of them. And we have an agency entirely dedicated to that that's paid for and run by industry and facilitated by ministry called WaterTap. It's a water technology accelerator. So Ms. Huff, if you and I can meet after, I'd like to set you up with them, and we maybe can get you to be one of their poster demonstration projects this year. But thank you for your leadership. I've been watching what you're doing, and I am a big fan. Thank you.
Thank you. Microphone number 4, please.
Thank you. First of all, my name is Eli Alchantieri. I'm a councillor of the City of Ottawa. Also, I'm the chair of the Ontario Association of Police Boards. I'd like to begin by apologizing to the minister, because I know she's my MPP, but also she's only been 2 weeks on the job, but she was on holiday. I never got a chance to ask her this question. And this question, I think, is important to all the audience here. Within only 6 weeks' notice, the Minister of Community Safety and Correctional Service canceled some 12-year-old grant program when many police services and municipal government had already set their 2017 budget. Also at stake is in provincial cost sharing of funding for over 2,000 frontline officers. And I know the minister is a big fan of the law enforcement people in this province. So Minister, can you give us some assurance that the grant change will not saddle our property taxpayer with a legacy cost, either in the short or a long term? And my advice, if I could, to you, if we can postpone this till at least 2018, because a lot of municipalities already set their budget for their police boards, including ours, and I think that will have some impact on the 2017. Okay. So I'll turn it to you, Madam.
Thank you. Minister Lalonde.
Okay, so I have 9 seconds, and I'm going to try. I think this is something that, one thing that I will say, thank you very much for your question, but we also had heard at various times, and I think you're all interested in this answer, but I'm going to look at my note a little bit more closely to answer you, Eli, on this one. The way we do policing in Ontario. One thing very important that I have to say is that it's important that we all realize that the funding allocation will not change. So all of you should know that as part of this transformation or new system, it will not change in terms of your funding. We are consulting with our stakeholders, with AMO, regarding the redesign of the grant program. And I would say, as a new minister, that if we want to have something, we need to do it right. We need to make sure that we're going to move forward in that sense, but also we want to move forward with you. So my commitment today is to continue the engagement, continue the conversation, but I just want to reiterate that the funding will not change for this year.
Okay. Thank you very much, Minister, and we've reached the end of our time. In fact, we've gone over our time extension, so I apologize to those of you that are left waiting. We did get 20 questions in, as we had hoped. And I'd like to thank all of you for being brief and thank the ministers and premier for being equally brief. And I apologize for the drama at the start. I'll probably now not get invited to host the Academy Awards, and I was looking forward to that. Minister Morrow, I believe, has an invitation.
Well, I do have an invitation, but first I'm sure that you will all join me in once again thanking Nigel for the great work that he does. Before I ran up to the stage, I pulled Nigel over and I wanted to know how many years he had been doing this, and even he doesn't remember how many years he's been doing this. All he said was my hair was much darker when I first started doing it, but he's doing it a long time, and I want to offer our thanks and congratulations to Nigel for his work. Also, let me just, I'll be speaking tomorrow morning to you, those of you that are still here at the conference, but I want to offer my thanks and congratulations to ROMA. I know this is your first standalone get-together conference in about 16 years, and I listened to Ron's speech this morning, and I know there was some concern with the organization on how well it would be attended and how well it would be pulled off, and I think by all metrics it's been a smashing success, so I offer my congratulations to Ron, to you and all of your team for pulling this off. I think it's been great. You've exceeded your numbers by, I think, at least 30%. So congratulations to you, and I want to offer my thanks and appreciation to my cabinet colleagues and parliamentary assistants as well. We've been pestering them for some months since we knew we were going to be having this conference. We've had a great representation and turnout from our cabinet as well. So another great partnership, another great expression of our collaboration and ability to work with you in the municipal sector. Congratulations to everybody on a fantastic conference that still continues. And so I want to invite you now. I'm told, if I can read this, the provincial reception begins immediately. It's in the Grand Ballroom East. We look forward to meeting you there and having a greater opportunity to have and continue our discussions. Thank you all, everybody. I appreciate it very much.